Hi, Robert Galarowicz from Healthy Kidney Inc., naturopath, nutritionist, kidney disease sufferer, and I want to discuss what parents can do to help their children avoid kidney failure in the future who had kidney disease as a child. So if your child has kidney disease, what they've shown is that there's a much greater risk that they can have kidney failure into their adulthood and into their teens and into their early adulthood. And so if this is a case where there's a lot of conditions, a lot of kidney conditions that could affect young children, they'll go into remission and be okay and they'll resolve these issues. But they're at a much higher risk for kidney disease and kidney failure later in life. So as a parent, there's a couple things you're going to want to do if your child has a history of kidney disease. First, you really want to check their blood pressure every 6 months or so. More the better. You don't want to do it constantly, but every couple of months, even if you did it once a month, that'd be fantastic, because you'll see any rise in blood pressure that could start causing an issue with the kidneys. So you want to check it often, once a month, once every 6 months, at least once every 6 months would be good. If not, at least once a year. But the point is, you do want to check it more regularly, as opposed to a child that may not have had any kidney disease when they were young. You want to reduce the salt intake. So as a parent, you're mainly in charge for the food. You're going to be in charge, maybe you're cooking, buying out, whatever it is, the food shopping. But you are going to be in charge of your child's diet, so you do want to limit sodium. So you want to avoid adding it to foods. You want to try and buy products in the store that are lower sodium, especially things like soups, which can be extremely high in sodium. You want to look for the lower sodium options. So you want to watch the blood pressure, low sodium. You want to keep your child active, especially in today's day and age. Children a lot are just on their phones, their iPads, their laptops, whatever it may be, and they're not as active. And exercise, activity is good for the body. It's good for the kidneys. So get your child outside, get out that old kickball, or have them ride their bicycle. So anything where they're active is going to help their health. So we got a couple things there. We got blood pressure, we got weight management, keep it active, low salt diet, weight management. Don't want to skip that. Very important. You don't want your child gaining a lot of weight, because if they gain a lot of weight, it puts more pressure on the kidneys. But usually when you're gaining more weight too, you're usually eating a lot of unhealthier foods, which is putting more stress. So you do want to watch the weight. Good thing to do to help that is really try to avoid a lot of sugary drinks, refined sugary drinks like soda, Coke, Pepsi, these type of things, Snapple, and go more for water and diluted fruit juices, okay? So that's fruit juices you dilute with water. So it cuts down the sugar content. It gives them a little bit of the natural sugar, which if they're active, they'll be burning it off, but they're not getting an excess of a lot of just junky, not good for you sugar. You also want to make sure they take a multivitamin. Okay, so we got multivitamin and vitamin D you want to get tested for. So in Brenner and Rector's The Kidney, this is like the Bible of nephrology, of medical texts. They always recommend a multivitamin because it's shown to improve all parameters of kidney disease. So that's Brenner and Rector's The Kidney. That's considered like the Bible of nephrology. So that's what they give to all the doctors when they're studying or getting out of school. And so multivitamin, and you want to get the vitamin D level tested. So whenever your child gets blood work, if they're not doing it already, which a lot of doctors aren't, you just want to ask for a vitamin D test. So just ask the doctor, can you please check vitamin D? And if they argue with you or fight you on it, that's a warning sign, okay? That's a warning sign that you probably need another doctor, because you want to do everything you can for your child's health, as well as yours, but especially your children, because you love them and you care for them. So multivitamin, make sure you get the vitamin D tested, low salt diet, weight management, dilute the fruit juices, okay? Blood pressure, you want to check that often. And these simple things you can do can really go far in your child's health. And it's not just kidney health. We're talking about overall health will improve. So more tips like this for kidney disease, kidney health, children, adults at healthykidneyinc.com. Thanks for watching, everyone. Have a good day. And to your best kidney health. Thanks for watching.